So good morning and welcome to this conversation. So today we are going to discuss a very important condition, and the condition we're discussing today is bipolar disorder. So I'd encourage you to tag somebody, invite somebody to join us in this conversation because we need to answer a few questions. Now, put something very, I need to say something very important here is that the goal of this conversation is to help you to be able to appreciate and be able to recognize bipolar disorder so that you are able to assist or to help somebody who needs help. Sometimes bipolar disorders, they sometimes are not very easily recognizable, and even when you see it, sometimes because of the way the disease presents, most members of society, especially in our communities, sometimes it goes without you really realizing that this is exactly what the issue is and that somebody actually needs help. So I'm going to go through bipolar disorder and I'll focus mainly on the features that you need to pay attention to for you to be able to recognize it and also be able to help somebody. In the meantime, do tell us where you're watching us from. We would like to know where you're catching us from. It really helps us to know where you are watching us from. So please go ahead and tell us where you're watching us from. I think I can see somebody here from Botswana. Yes, watching from Botswana, Joy Klape Klape. I hope Joy, am I pronouncing your name properly? Joy Klape Klape. Okay. Right, so my name is Dr. Mjajati, so we're going to discuss bipolar disorder. Now, bipolar disorder is a disease or a disorder of mood. Okay? The simple definition I can give you is that this is a mental illness and it's a disorder of mood. Now, the reason it is called bipolar is because it has extremes of mood where the person who is affected, there are times when their mood is very elevated. They feel extremely happy. And there are times when they have episodes when they are extremely depressed. And in between these two episodes, they feel fine. And because they have these two types of mood that are poles apart or they are opposites of each other, that's why it is even called bipolar. Bipolar because the two moods that they are into, being very happy and also at other times being very, very sad to the point of depression. And then in between they are fine. That's why it is called bipolar. Now, during the episodes when usually patients with bipolar disorder, they are easily recognizable even to members of the public or even to just ordinary people or even to their loved ones or relatives when they are in the opposite, in the other extreme of the mood, when they are very happy. Now, when their mood is very high and they are very happy and it's mixed with psychosis, it is called mania. And that period, they are said in medical language to be manic. Now, psychosis, I think we described it some time back, but in case you have forgotten, psychosis is basically defined as somebody who is unable to distinguish between what is real and what is not real. Okay, so that somebody is said to be psychotic. And they are psychotic because, number one, they are deluded Deluded in the sense that the reason we use the word delusion, the way we use the word delusion in medical language, this is somebody who holds to ideas that are internally generated within themselves, not that somebody told them. They are internally generated within themselves, and those ideas are false and they are not true, and you cannot change their mind even if you presented them with alternative facts or you presented them with evidence. They will not change their mind. They are said to be deluded, or they have delusions, or they are delusional. Now, and they are said to be psychotic if they're deluded, and also if they have hallucinations. Now, hallucinations, this is somebody who is either hearing voices or they are seeing visions. Now, the delusions that come with someone who has bipolar disorder, especially when they are in the manic phase. So in the manic phase, this is somebody who has a very high mood. Okay, they are very high mood, but it's also associated with psychosis. And the delusions that they have when they're in the manic phase, they have very, very, very elevated ideas of who they are or who they think they are. These are people who believe very strongly that they are a much better human being, much higher human being, and they look down on everybody. And they expect you to treat them that way. So those are the delusions you will find in people who are bipolar when they are in the manic phase. So we are going to discuss for you the features of a bipolar patient or bipolar patient when they're in the manic phase or their mood is very high. We walk through the features so that you're able to recognize that, okay, this looks manic now. Now, the phase of mania or manic phase, it can last even up to a month sometimes. In others, it goes even to 6 weeks. Sometimes it doesn't last very long, but it can last for some time. And then they will also go into a very depressed state. They become very, very depressed. You'll be surprised. So now, let me quickly walk you through. Having defined what bipolar is, and having shown you what the features are, let's now look at when their mood is very high and they're in the manic phase. How would you tell that this is a bipolar person who's in the manic phase? First of all, they are excessively happy when they're in the manic phase. Very, very happy, very hopeful, and very excited. That type of excitement that is beyond, that type of excitement that is very excessive, and they're usually very loud. They want people to know that they are happy. But here's one thing that you will notice that is very different about them is that they can very easily switch from being very happy and then suddenly very angry with you, like extremely angry. So that's how, you would notice that, okay, I think here someone could be in the manic phase. And they are usually restless when they're in the manic phase. They're very happy, but they're also very, very restless when they're in the manic phase. And they have what we call in medical language pressure of speech. Pressure of speech in the sense that they talk very fast, very rapid, and they have very disjointed ideas. Okay, they have very disjointed ideas and they talk very fast. And they have what we call pressure of speech. And then they have increased energy. They are like a ball of energy. Okay, they have the energy is so increased such that they struggle to sleep. You'll find that they don't sleep, these people. If you live with them, they'll be awake the whole night and talking and talking and talking. So they don't sleep. Another feature when they're in the manic phase is that they have a very unusually high sex drive. They have unusually high sex drive. And they become socially disinhibited. By becoming socially disinhibited, for example, if it's a lady, you will find that they 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 almost become like, you've come across a term called exhibitionist. Um, kukonda kuvula, like, and on top of that, you find that they engage in behavior that is socially inappropriate for your culture, for example. And if it's a lady, you will find that they'll be, dressed in a manner that is very revealing, but very inappropriately revealing, and they're okay in public, and very, very, very disinhibited. And you find that they start doing things that are very disjointed, and 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 they stop being shy, basically. But the loss of shyness is excessive, like very, very excessive. And they have what we call their delusions. They have what we call delusions of grandeur. Delusions of grandeur in the sense that they have a very inflated view of themselves. And if the delusions are religious, these are people who believe and want you to believe that they literally talk to God himself. Okay? They speak to God himself. And they want you to believe that. They could be manic, or they could be in a manic phase. And they make grand decisions that are very unrealistic. And they have very poor judgment when they're in that state. And usually manic people, with bipolar patients, when they're in the manic phase, you should pay attention. They also tend to abuse substances like alcohol and things like that, and other drugs. And they're very impulsive in the making of decisions, and their appetite is very low, and they have a very huge sense of self-confidence. Their self-confidence is way high during that period. And if they are men, they generally become reckless, and they take very risky decisions, and decisions that sometimes even risk their own life and also the lives of others. Those are the features that would tell you that this is a bipolar person who is in their manic phase, when they are excessively happy, when their mood is on the other side. Remember, we said bipolar is a disorder of mood, where you have both happy mood and depressed mood. Now, what happens when their mood goes the other way? When their mood goes the other way, where they are now depressed, they look extremely, extremely sad. You will not believe that this is the same person who was very happy. You will not believe that this is a person who was very confident. You will not believe that this is a person who had all these very exciting ideas, who had very, elevated view of themselves and excessively confident. When they get depressed, people with bipolar, they have a sense of worthlessness. They go to the extreme opposite. They feel very hopeless. They don't enjoy life anymore. They struggle concentrating. They become very forgetful. And surprisingly, remember that when their mood is very high and elated and in the manic phase, they have what we call pressure of speech. When they are depressed, their speech becomes very slow and slurred, very slow. And they have less sex drive. They are just not interested in sex anymore. But when they're in their manic phase, their sex drive is... They have inability to feel pleasure anymore, and they can cry uncontrollably when they are depressed. Or when their mood is low, they can cry for hours. And they become very irritable, and they sleep a lot more, like they sleep for long hours. But again, remember we said when they're in their manic phase, they don't sleep. When they're in their depressive state or depressed state, or their mood is depressed, they sleep for long hours. And here's the thing, suicide attempt is very frequent when they're in the depressed state, and actual suicide is very common. Now, the reason they are said to have bipolar disorder is that these are people who, there are times when they experience that elation or elevated mood, which we described earlier, which we described as mania, and we told you what mania is. And at the same time, these are people who later on may also experience depression. But in between these two episodes, you'll find that they're actually fine. Even they themselves, they feel fine. Now, these features I've described, you may have seen them in people or one or two features in somebody, but here's what distinguishes a bipolar disorder person. The distinguishing feature is that these features makes them dysfunctional in the sense that it disrupts their lives. Such that, for example, if they work or they have a job, they cannot perform that task anymore because they're in that mood. They just can't carry out useful activity. So just because you've seen somebody behave in a manner that suggests that they could be bipolar, but if their life is not disrupted, don't be in a hurry to suggest that somebody is bipolar. But remember that any of these excesses, very high mood, very excessively happy, and usually people who have a very high self-esteem and they look at themselves as higher than everybody else in a very destructive way, and they are so happy, but yet at the same time they can very easily get angry with you, then just know that they're in the manic phase and they could be bipolar disorder and they need to see somebody. So that's how you distinguish, and that's how you tell whether someone has a bipolar disorder. And how you help them is that you need to take them to the nearest hospital where they can see a psychiatrist, because there's treatment for these things and these things can be controlled. However, understand that bipolar can be treated both from home and in the hospital. And where somebody, their disease is putting other people's lives at risk or their own life at risk, they may actually need to be admitted or committed to an institution. Remember, we said that patients with bipolar, when they're in their manic phase, they tend to take very risky behavior, especially if they are men, and they can actually either harm themselves or harm other people. So just bear those in mind. And so that's what I thought I should share with you, so that you are able to recognize bipolar disorder when you see it. And when you see it, instead of making fun of people or, you need to help them. You need to help them. Take them to the nearest hospital. That said, this has been Dr. Mjajati discussing bipolar with you this morning. And if you have any questions, I will go through the questions and then see how we can assist you. In the meantime, here's what you're going to do. Share this video. Share this video as widely as possible, because we need as many people as possible to be aware of these issues. Do take care until next time. Good morning.